say thank you to you are amazing. Same to you.
My name is Peter Kroll. I'm the director of the Bonn International Center for Conversion, which is one of the larger peace research institutes in Germany. I consider this relation between violence, between war and health has been somehow neglected, or at least not put into the position where it actually belongs to.
I'm Gilbert Burnham. I'm professor of international health at the Johns Hopkins Bloomberg School of Public Health in Baltimore. Yes, I'm going to talk about the health systems, measuring health system performance, something we haven't regularly done in emergency situations. And I'm going to use two examples. I'm going to use examples from Afghanistan, where we've been measuring health systems performance for the last 5 years, and also some examples from Iraq, using some new approaches for measuring what's happening in a health system where one doesn't have full access to information.
Jeremy Kane. When I was a master's student at Emory, I focused on the conflict in northern Uganda, and we did some mental health research there. So that's what I'm presenting today.
My name is Dr. Sopan Kachop.
And where are you from?
I'm from India. Okay. I work with Medicine Sans Frontier in India as assistant director. I think the way it's organized is quite good. I mean, like with different small work groups where you can have detailed discussion about different topics, and then the social events where you can have more informal chats and then get to know more people there.
My institute is working on issues like disarmament, demobilization and reintegration, but also on migration, and as well on resources and conflict. And I think in this particular area, the consideration of health issues has not been put into the place where it actually should be put. One of the major reasons to participate in the conference was not so much to deliver a lecture. I gave this introduction into militarization and the global military index. But this was one reason. But the other reason was rather to learn, to get some input from the health people, what they think and how it could be influenced, or how health could take a more leading role in conflict and war-like. So I think it was.
I think it's been great, especially for mental health topics. Typically, you go to a conference and this kind of thing isn't discussed at all, or if it is, it's kind of shoved off into a corner. But here you have, a bunch of mental health experts who have been doing this work for a long time and have contributed a lot to the field. So to get all of us together to discuss these things, I think is fantastic. I think it's great.
It's been very well organized. I've been very impressed with that, and I've had an opportunity to get new ideas from different people, to think about what other people are doing and how we could apply that in the various work that we're doing. And so I think overall it's been certainly exceeded my expectations. But saying that, I wasn't sure what to expect in the first place, but it was very good.